Hi, this is Christina Connors, occupational therapist and president of the Get Well Map Foundation. I'm excited to share more with you about our Get Well Maps and how they're designed to be tools to enhance child-centered communication between children, families, and medical teams during childhood hospitalizations as well as other medical challenges. So I'm going to walk you through the step-by-step instructions that are included in each one of our Get Well Maps. We're going to start by opening it up. Each one comes sealed. We're going to get rid of that plastic, of course, so it's not a safety hazard for children. And our maps each come on a 12 by 18 wipeable surface. They're designed to be brought next to the bedside or placed in some prominent place in the room. Each one comes with a repositionable sticker that has a little tag on it that says "Move Me," that indicates that it should be used in an interactive manner. On the back, we have instructions in English and in Spanish. We have a place for the medical team to autograph the map either on discharge day or throughout the medical experience. And then we have a place for an organization logo. So if you're a business owner or a director of an organization and you'd like to sponsor our Get Well Maps, we would certainly appreciate your support in getting our maps into the hands of kids and families that are experiencing medical challenges. So let me show you how we're going to make this a bit more individualized for each child. At this point, we actually have 7 themes that are all designed to be fun and engaging and really tailored towards the interest of the child. And we do this in collaboration with John Donato, a wonderful artist who really brings our concepts to fruition with really fun and engaging, bold, bright artwork. So I'm going to actually switch over to our original theme, The Road Home, which was developed following my son's medical experience. And several years ago, I was really looking for a way to help him understand that we were going to reach our goal, and in his case of going home from the hospital. And we really wanted to develop a tool that would help kids visualize progress towards their most meaningful goals. In the case of childhood hospitalization, we know that even with the best discharge planning, dates can often change, and with young children, understanding of time is challenging, especially in a hospital environment where days and nights can blur together. They're out of their daily routine, and that really becomes a challenge. So a way to visualize progress seemed to be a more appropriate, developmentally appropriate, and child-centered manner to do that. So the first thing we're going to do is to actually write the child's name up in the top right corner. This one is already done. It says Andrew. If the child's old enough, they can write their own name or have some assistance from an adult. Different colored Sharpies, rainbow, all different ways to just start that individualization of the map. And then we want to actually put a picture of the child in that left corner. This is something that parents and family members can help with. It can be something that the medical team facilitates if it's a picture of the child, but this can really start some of that dialogue. You know, medical professionals might want to know where your child is from or what they enjoy doing. So often a picture of your child healthy and maybe engaging in activity that they love is a great way to pick them up in the left corner. And then we actually want to put a picture of the goal. Now this is something that really can turn into a therapeutic conversation with the help of a child life specialist, a pediatric social worker, or a nurse, or a physician, but we really want to get down to what is most meaningful to the child. And the adult can certainly help facilitate that. The family should be involved in that dialogue. So maybe it's a picture of home. Maybe it's something that represents their house or a pet that they're eager to get back to. Maybe in the case of an outpatient journey, maybe this is not a child who's hospitalized, but maybe going back and forth for different medical procedures. Maybe it's a picture of an activity that they would like to do with their family when they're no longer immunocompromised or they're in better health. Or maybe it's another transition, like getting back to school. Maybe they miss their peers and some of what represents their regular activities. So that can be something that's depicted up there as well. Oftentimes, we have child life specialists that mention that the child wants to illustrate their goal. And maybe it's a series of short-term goals that's depicted here. Maybe when they're well enough to be off the unit, to go out to the playground and things such as that, that can either be written or illustrated on a little note card and taped up here. So as I mentioned before, each Get Well map includes a sticker, and this is moved in correspondence with the child's progress. This is a great visual support that can be utilized during medical rounding. And one thing that we do have as an indicator on our map is that we always want to see forward progress. But we know that all too often setbacks can occur. And so each one of our maps is designed with something we call a neutral zone. So in this case is a pit stop. In our journey home, our superhero theme, it's a hero headquarters. Or in our princess theme, it's a castle rest stop. So it's a way to help soften some of that medical jargon because setbacks do occur. Maybe the child needs another surgery or their counts are not where they need to be. And this is a way to help soften that. Just as a princess may get a tear in her ball gown and maybe needs that mended, or she needs a new rhinestone put in her tiara. Race cars, they need a fresh set of tires, or they need to go to the mechanic to figure out what's going on with their engine. A superhero might need his jetpack repaired. So it's all ways to help provide still an encouraging mentality when a setback is occurring that might be delaying progress towards the goal. So we encourage the medical team to facilitate that conversation. The medical team really should be the one that is advancing this sticker towards the goal. And normally we just suggest kind of creeping it along as we go. The other thing that we do encourage either the medical team or the family to do is to utilize, I seem to have misplaced my Sharpie, but this can be noted with some milestones that are individualized to the child and family on here. Or it could be a series of little post-it flags that can be put on here as well. Maybe it was a visit from a grandparent or a visit from the pet therapy dog on the unit. Maybe being off of the unit because their immune system is beginning to function better. Those are all things that can be noted on the map, again, either with a Sharpie or a little flag, as things that really kind of highlighted some positive progress or some things that were really meaningful to the child and family. Again, this is used on discharge day as a place for autographs, or can be utilized throughout the medical journey, but this is really designed to be a keepsake for the child and family to take home with them, whether it's on discharge day, and also to serve as a resource for other transitions. Maybe the child is going home but won't be returning to school for a couple weeks, and this is a way to help visualize progression towards those other goals as well. Any questions, you can find us at www.getwellmaps.org. Our Get Well maps are also available at Smile Makers, and if you work for a pediatric healthcare organization, you may already have a vendor account with Smile Makers. So this family-centered tool can be found with them as well. And if you would like to support us and sponsor maps, we would love to hear from you.